Well, thank you so much for joining me today, Dr. Chilukuri. I want to start off by asking you, can you just tell me a little bit about your practice and what you specialize in?
Certainly. I've been blessed. I'm in cosmetic dermatology. So I trained originally in surgery and then moved into dermatology and then moved into micrographic surgery, most micrographic surgery, as well as lasers. What's trended or happened over the last 20 years is remarkable because we are able to give close to surgical results without surgery. So the basis of my practice, over 90% of my practice is non-surgical, and it's just restoration of the face, of the eyelids, of the neck, and of course body contouring is continues to grow in double digits. So we're able to provide the opportunity for clients and patients to stay looking the same no matter how old we get chronologically.
And in such a large market, what is your practice doing that others aren't? How are you staying ahead?
Certainly. So I don't know if it's that other practices are not doing it. It's our practice brand is really built on technology and innovation. So when you talk about a bell-shaped curve, when you're introducing something into the market, we always tend to be on the left-hand side. So I'm an innovator. I tend to be an early adopter for technology. But what we guarantee to our patients is that we're using technology that works consistently and realistically gives amazing results. So I'm always a big proponent of under promise and over deliver. And with that, along with the patient experience that we provide, I think we've been very blessed to be successful in this space. I know there's a lot of other people in this space, and I can't say we ever compete against anybody else, but we definitely compete against ourselves. We want to make sure that what we do tomorrow is better than today, and what we do today is definitely better than yesterday. So that's always our goal.
Absolutely. They always say your biggest competition is yourself. So I definitely resonate with that. And my
Absolutely.
next question, I would like to talk a little bit more about QWO. So can you explain what it is and how significant this treatment is compared to other options?
Definitely. So QWO is a fantastic tool for our toolbox against cellulite. How it works, it's a collagenase. So anything that's an ASE tends to be an enzyme. So in this case, they're using an enzyme to actually break down the fibrous bands for cellulite. So with cellulite, there's typically four aspects of this condition. And unfortunately, it's very popular because what happens is 90% of most women at some point in time will have a form of cellulite. In terms of men, it's approximately 10%. And the reason for that, it's all physiologic. So we're talking about what the difference anatomy is going to be. In terms of men, there's a lot of little individual pockets and they have wider fiber septi, so they're a little bit more sturdy. For women, again, it's more delicate, it's a little bit finer, and those fiber septi, because they're a little bit smaller and narrower, they don't have as much strength that's there. Some of these septi you're going to see are actually pulling down on the skin. So I describe it like this. If this is the surface of the skin as a youth, what ends up happening as that fiber septi starts growing and pulling in, it pulls like that. So you have this little dimpling that's there. So the way that QWO works is to address that dimple. It uses the collagenase to break down that the collagen septi, and then inside there, there's going to be an arteriole and venule. And so when you're talking about this quote unquote side effect that comes from it, yes, it definitely gets rid of that fibrous band, but because there's an arteriole and venule that's inside that tiny little space, they actually get sheared and it causes some bruising, which was very, very common. There's three other aspects for cellulite that we want to address, and it's not necessarily with QWO yet, but we can use other modalities within our office. So one, of course, is going to be fat. So there's a lot of different modalities that you can do to destroy fat or even remove fat with surgical interventions such as liposuction. The next thing that we know is that there's going to be some loose skin. And depending on the age of the patient that's coming in, you often find in women in their 30s, late 30s to early 40s, they're not producing as much collagen or elastin as is being destroyed on a daily basis. So after that age, we continue to withdraw collagen, but we're not putting it back in. So we have to think of modalities that are going to help us put it back in. The last component there is going to be fitness. So it's the muscle that's a three-dimensional structure that's actually pulling up the skin and holding it in place and keeping it taut. So those are the four aspects. Again, QWO is one of the newest tools. It's the only injectable tool that we have to break up the fiber spans.
Yeah, that's absolutely amazing what kind of technology they've come up with now compared to what we've had previously.
It really
My
is.
next question I have for you is What is your practice doing specifically with this procedure that might be different from others?
Certainly. One of the things that we're seeing nationwide, as well as it's been addressed in the studies themselves, is what can we do to accelerate the resolution of that swelling and the edema that's there, as well as the bruise. Because I'm going to send some pictures and you're going to be able to see it on your screen very shortly. The bruising is pretty tremendous. And again, it's expected. We know that it's going to happen. So tell your patient, your client, that it's going to happen. I think we're unique in two aspects. Number one, we're one of the few practices in the world that actually gets to use QWO. There's, if I'm not mistaken, there's approximately 100 different offices throughout the US right now that are cleared to use QWO because it's a very targeted approach to make sure that we get to understand the device, understand how to use it effectively, and make sure that every single patient gets a very consistent and tremendous result. So that's number one. With that bruising, a lot of different dermatologists and plastic surgeons have tried a variety of technologies to make it go away faster. Can we use topical arnica? We saw no change. Can we use arnica infused or vitamin K infused patches? We saw no change. Can we use lasers? So whether it's an Nd:YAG laser, a pulse dye laser, things that work on the face, on the lip, on the neck, they don't work. So again, thinking about what the physiology is and what's changed, knowing that we take that fiber span, we have the shearing of the blood and the blood vessels, we have these huge pools. So what can we do to accelerate the resolution of that? Well, if we can bring more blood flow in there, we can use the macrophages to get rid of that blood, get rid of the debris, and also improve the overall area. So I'm using a combination of, in one device, it's a acoustic wave or a pressure wave that's there, along with radio frequency. If you don't have something that's this particular device, and I think this is a CME talk, so I can't say the name yet, but it's by BTL Technologies, then you can use two separate devices. One is the acoustic wave device itself, and there's two major companies in the US that produce this. One is by Zimmer and one is by BTL. And then you can use whatever radio frequency that you have. What's the ideal temperature that you want to bring it up to? You want to bring it approximately 41 to 43 degrees. If you can go 42 to 44 degrees, you get even a better result. When should you do the first treatment? Some people are proposing that you do it immediately afterwards. If you talk to the scientist at Endo, the research lab that created this product, what they're anticipating is that the collagenase can actually sit inside that area for up to 36 or 48 hours and it's still working. I don't want to spread that very targeted collagenase to other areas because it's non-specific. So it's going to go ahead and break down collagen anywhere you inject it. So because we're injecting it directly into the band and then at a 45 degree angle, we know it's localized to that area. So I'm waiting a minimum of 2 days to bring the patient back in using this acoustic wave combined with radio frequency device, and we're seeing tremendous changes. After the first treatment, I bring the patient back usually on a day 3 or day 4 and do one more treatment. And by the end of that week, it's almost imperceptible, if not completely gone. And again, I'm going to share those photos with you, and hopefully you're going to be able to put those up, Morgan, to share with our viewers.
Absolutely. And my last question I have for you, do you have any tips for practices that might be struggling to get patients back in the door now that things are opening back up?
Certainly. I think one of the biggest dilemmas that people have is, do I want new patients? And I know I've asked this in a room of over 2,000 people at several different conferences, both at Vegas Cosmetic Surgery as well as the aesthetic show. So two different groups of practitioners that are there. And I always say, raise your hand if you want new patients. And everybody's hand stands up. And I'm standing at the front of the room. I said, well, I guess I must be the anomaly because I don't want new patients. I want to bring back those patients that trust in us and believe in us. And they know that whatever we're offering, because they quote unquote, not quote, they actually trust us. That's my favorite 5-letter word in the office. They're willing to try new things with us. They're willing to spend on those things with us. And they know that we're going to do what's best in their interest. So if you're struggling to bring patients back in, rather than going and spending on ads trying to find new patients, focus internally. Go back to your database and look through and say, when did this person last come for neuromodulator? Okay, if not neuromodulator, when did they come last for their filler? If it's been more than 6 months to a year, that's somebody that you can recall. If somebody has recently come for Botox, have you shown them other things that you can offer in your off that you can offer inside of your office? For instance, can you offer a complimentary peel and introduce them to that aspect? Can you bring them in for a hydrofacial and improve on their results? Can you do a lightweight laser where it's a non-ablative, let's say erbium YAG or an ND YAG laser, where it's just going to brighten the face with minimal consumable cost? It's another opportunity, another touch point to bring that patient back in. So I say rather than looking out, look inside and make sure that you can recall those patients. If you're finding that a lot of patients are one and done, meaning they come in one time, they try the Botox or try the neuromodulator or they try the filler and they go somewhere else, also look internally, but this time look in the mirror and see what's going on behind the scenes that's allowing or encouraging that patient to leave. In our practice, we've been so blessed since October of 2016, we haven't taken new patients unless you have a word of mouth referral. In November of 2019, we actually cut it down even further because we were still seeing new patients. And I just don't have the capacity to provide the experience for these patients that we want to guarantee. So now we've made it to where you have to have two referrals that have to get you in the door to come in and visit with us. Why? It allows us to provide the highest quality of service, make sure that we're accessible for the patients, and make sure that we spend enough time to do those procedures that are going to keep them looking the same forever. So look internally and see, is it something that's a breakdown in your practice that's not allowing that patient to come back? Be more like, where it's a family. With our Refresh Dermatology family, it's Hotel California. I want them to check in, but I don't want to give them a reason to check out. Thanks for coming.